Hi, my name is Dr. Tom Sladek. In today's video, I want to explain to you a very important concept, and you need to understand this because this is what causes heart disease. Now, many of you know, and you've pictured in your mind, you've heard of plaque developing inside the arteries. Well, what causes that plaque? Many people that consult with me, they believe that, they eat a piece of fat and that's going to flow through their body and that's going to develop plaque and that's going to develop a heart attack and they're going to die as a result of that. It doesn't happen that way. There's more to it than that. Now, the true cause of heart disease is inflammation. And one of the best ways to visualize this in a really simple way is if you take your hand and your finger and you start scratching your skin. And scratch it real hard and keep on scratching, keep on scratching. And what you'll notice is that your skin starts turning red, it starts getting hot. Okay, now picture that in your mind. That's inflammation. Now if that's going on inside your arteries, that's going to cause a problem. So the problem that it causes is that the immune system is going to get called into action and want to fix this damage that's occurring. And what's going to happen is cholesterol and oxidized cells and things are going to get called to the scene to fix the problem. But the true culprit here, what ignited the process, was the inflammatory response. Okay, do you understand that? So if we look behind me, now I'm not an artist and I'm never going to be one, but I just want you to get the big picture here. What I drew behind me was an example of an artery. So you see the inside here, and then this would be the outer layer, okay? And then you see this one line here and then one line there. So there's a layer around the muscle called the endothelial layer. This is where the action takes place, and that's where the problems are. So if you look over here, we can see a little bit of plaque and foam cells building up, correct? So what happened was the inflammatory response across the arterial wall. Cholesterol came to the area. Cholesterol came to the area, and you can see we got a little plaque building up. Now, if the inflammatory response isn't taken care of and you don't stop that, this condition is going to continue to progress until that plaque becomes bigger, bigger, and bigger. And if it becomes unstable, then it can pop, and there's your heart attack. So, the key to correcting this is finding out if you have inflammation. And there's markers to do that. Watch some other videos that I have and you'll know exactly what you need to test to find out if you have the inflammatory response. But ladies and gentlemen, it's the inflammation that's the key here. Inflammation's the culprit, and you need to get that under control, because if there's no inflammation, cholesterol is just going to flow freely across the artery. It's not going to stick to the wall. That's the key. I hope you liked this video. If you need more information, please visit my website.